Good evening. I would like to welcome you to tonight's virtual workshop titled Treating Hispanic and Latino Skin, the One Technology Leading the Way. If you have questions during today's event, please enter them in the Q&A box. We will answer as we go along. If you encounter any issues with the video or connection, please refresh your browser, as that will often fix minor issues. Google Chrome is the preferred browser. The information and photographs contained in this presentation are the property of Candela and its consulting physicians and are provided for educational and discussion purposes only. By sharing this information, neither Candela nor its consulting physicians give you the rights to use the information presented. By participating in this webinar, you agree not to photograph, reproduce, or distribute any of the information presented in this webinar. With that, I am very pleased to introduce Dr. Kanika Shalin, VP of Clinical Operations and Medical Director at Candela, and owner of the Med Spa, the Center for Modern Aesthetic Medicine in Jacksonville, Florida.
Thank you, Grace. We're very excited this evening to be able to bring you this presentation. Tonight we have joining us Dr. Bertha Baum, who is based in Hollywood, Florida. And Dr. Baum is a board-certified dermatologist and a cosmetic surgeon, and she is an affiliate of the American Osteopathic College of Dermatology and a member of course, the AD, the ACS, the ASDS, and ASLMS. Her education and training is based from the University of Miami and the Nova Southeastern, and she did her internship at Westchester Hospital and her residency in dermatology at NSU-COM Larkin Community Hospital, where she was chief resident. And Dr. Baum has a lovely practice in Hollywood, Florida, where she treats a variety of patients, but has a real expertise in treating Latino and Hispanic patients. And tonight we're here to talk about how she uses one platform in particular, the Nordlys platform, in all its versatility to obtain a variety of wonderful results with Nordlys. So Dr. Baum, welcome. Thank you all for joining us, and I will let you take it away.
Thank you, Dr. Shalin. What a great introduction. I'm so excited to be here with all of you. I really feel honored to be part of the Candela family and to talk specifically about Hispanic skin, because as you can tell from my accent, I am originally from Colombia, so I have a lot of Hispanic patients, and I really enjoy the Nordlys platform because it has given me the chance to treat Hispanic patients. So very important right now is to understand the definition of what Hispanic and Latino is, because I am going to be using this word interchangeably. And when I refer to Hispanics, I'm really referring to Latinos and the full spectrum. But it is important to understand that there is a little bit of a difference in the wording, and there is a mixture of the two, but for the purpose of this presentation, we're going to be referring to Hispanics or Latinos, and they're all going to be this big group all together. And with that said, the reason for, we are here in South Florida, so obviously we do have a lot of Hispanic population, but we have shown the growth of the Hispanic population in the recent years. And I think that's very important as a physician, because you want to have the right treatments to offer to your Hispanic population. It is supposed to be 29% of the population in the United States in 2060. So we expect about 110 million Hispanics to pretty much be in this country by 2060. So obviously there is about a 52% increase in the total number of Hispanic patients who have been receiving cosmetic procedures within the past 10 years. And that's a very important data, because you're going to continue to see an increase in that type of patient showing up in your office. So you want to have the correct treatment for the Hispanic skin. More importantly, I think it all boils down to skin types, because the Hispanic population obviously has all sorts of different skin types, and you will find, patients that have Fitzpatrick type 1 or 2, and then you'll find Hispanic patients that have Fitzpatrick 6. So there is a variety of different skin types, and obviously most of the time we do refer to them as olive skin, but you will definitely know, and in these pictures you can see that, you know, we have Estelle Bunchen from Brazil, Sofia Vergara from Colombia, Jennifer Lopez, all these different famous individuals that have very different skin types and skin tones. So I think it is important to understand that because you're Hispanic, it doesn't mean that you have one skin tone and that's it. So as you can see, they've done different surveys and they found that 80% of US Hispanics consider themselves in the lighter spectrum of the skin types. And that's important because first, that means that maybe they're not seeing themselves as having a darker skin tone, but also more importantly is that, as I said before, some of them don't have darker skin tones. They have more, what I've seen in my practice over the years is Fitzpatrick 3 to 4. And that can be treated, and I'll talk a little bit more about it. So again, Fitzpatrick skin types, typically 3 and 4, as I mentioned, and they've done different studies, and that's what they found, that the majority of Hispanic or Latin American women identify based on the physician between the Fitzpatrick skin type 3 and 4. And so this is important to know because the Nordlys platform, which we'll talk more about it, has an application and kind of like an FDA approval and settings to treat Fitzpatrick 3 and 4, and we'll speak more about it. But there are common dermatological disorders that we have seen in Hispanic skin, of course. Some of them, like melasma, which is a treatment that we know is a little harder to treat, and I try not to use lasers in that aspect, but it is a common condition. But then we'll have patients that come in with post-inflammatory hyperpigmentation, either secondary from acne, inflammation, or papules that happened before, or they're having active acne treatment, as well as lentiginous and eczema or atopic dermatitis are some of the common conditions that affect Hispanic patients, and that is very important to understand and know about when you're treating the Hispanic population. So they've done different surveys, and they found that they asked a lot of Hispanic women, I can't remember the amount of people that they asked, but they basically looked at what would be the #1 reason that you would visit a physician or consider visiting a physician or talking to a physician, and what would be the reason you would go. So most of them said facial wrinkles, but as you can see, a lot of them said uneven skin tone of their skin, or dark circles under the eyes, large pores. So there's a lot of reasons why they would visit a dermatologist or a physician. And I think that's very important because that shows you their interest, and it is a population that is very interested in skincare and maintaining their skin conditions and looking youthful. So as you're all here for one reason, and it's because I wanted to introduce you to the Nordlys technology, which is excellent, and it's one of my favorite platforms in the office. I use it all the time, and I think it's very important to find a technology that works for your office and that doesn't have disposables, because disposables, when you're buying a first-time device or any device for your office, you need to take that into account. And I think that's important to consider as well, but more importantly, if it's going to be safe and effective for your patient clientele. So the Nordlys system is a great platform because it has multiple handpieces, and they have different applications. They actually have 22 FDA cleared indications, which we'll talk more about it. But basically you have the selective waveband technology, which we'll also discuss in a little bit, but it's this narrow band IPL that is going to let you treat vascularity, pigment, and hair removal. And it also has the FRAX, the FRAX has basically, there's two different hand pieces, the FRAX 1550, which is the one that I have, and it's a fractional non-ablative laser for deeper skin resurfacing. And then there's the FRAX 1940, which is an epidermal resurfacing device, and it's good for benign pigmented lesions. The ND-YAG 1064 is one of my favorites because you can really see those blood vessels disappear immediately, so it's great for vascularity. You can treat leg veins as well, and it's excellent for onychomycosis and wart treatments. So I think the versatility of the device is great. It will allow you to treat, you know, all of the family pretty much, patients with different conditions. And I literally just put in my patient in my laser room. If they have a wart and we've done different treatments and it's not working, I'll put them in there, treat it, and they appreciate that. So I think it's important to have something like this to offer to your patients. And then my favorite, it's the light and bright treatment. I think stacking treatments is one of my favorite things to do. I really think that when you have the technology and you can stack different treatments together, you can really address different aspects of their skin at once, and they really appreciate that. So I'll stack in, you know, my 530 together with my FRAX 1550, and I'll show you more about this. And then I treat, you know, my pigment, vascularity, skin resurfacing, so the patients appreciate that. So as I said, 22 FDA cleared indications, which makes this device pretty great in terms of all the things that you can treat, all the conditions. You can treat all sorts of vascularity, such as telangiectasias, rosacea, port wine stain, poikiloderma observata on the chest. That's another thing. You can treat body and face. You can treat epidermal pigmented lesions. You can treat acne scars. You can obviously do hair reduction as well, all sorts of skin rejuvenation, skin resurfacing with the 1550 and the 1940. And as I said, onychomycosis and all these great other venous lakes. That's another one that patients come in and they really dislike their venous lake, and they say, oh, no one has treated this before. And I tell them it's very simple, and they see the results and they love it.
Dr. Baum,
yes.
How long have you had your Nordlys? Can you tell the audience how long you had it? And after you got it, what was your experience? How quickly do you think it was?
I have had my Nordlys, I think, for about 2 years at this point, maybe a little less. And I think I paid it off after like a couple of months, to be honest with you, because of the amount of treatments. I did have an IPL before, and I have other devices. So I obviously have that diversity in my office already where my patients were doing treatments, but it is a very fast device, which we were discussing before. And I think that's so important because for me, and for most of us, obviously time is of value. And honestly, when they show me devices that take more than 10, 15 minutes to treat, it's just not gonna be doable for my practice. Obviously, if we're talking about a CO2 device or something that is going to need a little more time with the patient, I understand that. But when it's an IPL treatment or a light and bright treatment, I really want to go in and out and get my patients the right results. Obviously, the correct outcome, but at the same time being able to continue to see the same amount of patients that I see on a day-to-day basis, and my practice is busy. So I really like that about the device, that it's fast, it's easy to use, it's very easy to disconnect the hand pieces, which if you've had another IPL, you appreciate that because some of them are very complicated when it comes to, switching from one to the other setting. Here, you literally disconnect and connect, and it's ready to go. And it's very dummy proof as well. Like when you're starting off, if you haven't done enough IPLs and you want to understand more of like the settings, obviously they give you a lot of training, but more importantly is that the settings are built in, and I'll show that in a second.
Thank you.
Of course. So one of the things that I was telling you is the applicators are FDA clear for the use on skin types 3 and 4. And you will see I've treated many patients with settings that are built in, and also my own settings. There is an expert mode. So you will be able to switch the settings around and switch the fluence and all of that. So basically, the targeted wavelengths and technologies that we have with the Nordlys are able to be applied to the Hispanic population. And this is the only IPL with selective waveband technology. And we'll talk more about that, but it is a narrowband light. And so because of that, it lowers the fluence requirements, and it will require 50% less than the broadband IPL. And that is very important because by reducing the heat delivery, the amount of heat that you put on the skin, you're going to minimize the risk of post-inflammatory hyperpigmentation and other complications that happen with skin of color and darker skin types. Because obviously, the darker you are, the more melanin production you're going to have. And because of that, you have a higher chance of post-inflammatory hyperpigmentation. So you can actually do those short pulse duration delivery, and that will allow you to have less risk. So to understand this a little better, if you're not familiar with IPL and lasers and the difference, basically intense pulse light, or IPL, is a polychromatic, incoherent, and unfocused treatment. So you're basically using all these wavelengths together, and you're kind of like delivering them to the skin. And that works with broadband IPL because there's different types of IPL. With the broadband that has all those wavelengths up to 1400 nanometers, it works well with skin types 1 and 2, but you run into trouble with skin types 3 and 4, and obviously further on, because you can overheat the skin and you run the risk of hypo or hyperpigmentation. Now, laser devices, what they're doing is they are monochromatic, so it's like a coherent focus, one wavelength device that you're delivering to the skin. Now, that has good things and bad things in it. And that's why I always explain to my residents and the people that come to the office and learn with me that it's good to have everything. Because if you have a patient that has a skin type 3 and has a combination of vascularity and pigment, by using a little bit of a broader spectrum, you can treat both at the same time. When you're using a laser, you're specifically targeting one beam, one specific wavelength. So again, there's 3 types of IPL. We talked about the broadband, which is a common IPL that is in the market. Now we have also the second type, which is the narrowband IPL. And that's a little more narrower, and it removes obviously some of like those harmful wavelengths. But the good thing about the Nordlys IPL, which is the only one in the market that has selective waveband technology, it really minimizes the risk because, as I said before, it delivers 50% less fluence than the regular IPL. And by doing that, they're really removing the wavebands of light at those ends of the spectrum, and wavelengths above 950 nanometers that can be very harmful to the skin, especially when you have skin types 3 and 4. Those get thrown out, and it's a little more narrow. And because of that, together with the water filters that it has and the ability of controlling the pulses, you really have a lot of skin protection. So again, there's 3 elements of the SWT, or the selective waveband technology. that make it a little different, and because of that, safer to use. So you have the dual light filters, and these are filters that narrow that spectrum of wavelengths that you could deliver into the skin. So depending on the one you select, there's the PR, which is 530, and that 530 will go from 530 to like 750 nanometers, so it's smaller. The 555, the VL, will go from 555 to 950 nanometers. So very narrow. And because of that, together with that built-in water filter that is in the handpiece, you're eliminating requirements for external skin cooler, although I still use the gel because it's going to give you a little bit of cooling effect on the skin. But it is delivering with that water that is built in, a cooling effect on the skin, and that helps. And more importantly, you have the customizable pulses, which it allows you to control the time, the delay, the number of sequence, and depending on the target, if you have like a large vessel, you want to really deliver it slow. If you have tiny vessels, you want to deliver those pulses faster. So there's different things that you can do with the device. And as you become more and more comfortable with it, you will use that expert application more and more. So we have some videos that we created, and I think it's fun to show you the videos before we go into the before and after. So you can actually see what it's like to treat the patient if you don't have the device in your office. I think this is a good thing to see and kind of like appreciate. So here we go. I'm going to play the video.
We're going to be applying this gel. It's an ultrasound gel, and this is going to help in the process of doing the IPL and just giving her some cooling as well. In terms of the expectations for Brooke, this next week she'll have some darkening of the spots, and then they'll either fall off or just kind of like dissipate, and new skin will grow without any pigmentation. So this will be perfect for all those tiny sprinkles of brown dots that she's noticed from sun damage, which we call lentigos. So one of the great things about this Nordlys is that it's very ergonomic, and it helps you move around so that you can visualize your settings at all time while treating the patient. And it also has an expert mode, which is this type of setting where I can actually change the number of pulses that I'm going to be delivering to the patient, the pulse time, if I want to deliver it a little faster or slower, and how long is the delay in between pulses. Now we're going to start treating our patient here. So I'm going to press the plate mode. You can also do that by double clicking in the head of the device, and then it's now ready to go. It's going to feel like a little snap and heat. How is it feeling for you? Perfect. Excellent. Just make sure that she's not too red. She's reacting well. So she's getting that nice erythema that we want. You want to get any hairs out of the way so that you don't treat the hairs. And as you can see, she doesn't have a lot of pigmentation, but now we can see those brown spots start to get darker, which is what we want during the treatment. While treating the patient, I always make sure we have about a 20% overlap, like with any other IPL device, to prevent any issues with the skin. I'm going to do the upper lip on this side now. And in terms of pain, Brooke, how bad is this?
It's not bad at all. Very tolerable.
Good.
Okay, excellent. So I hope you enjoyed a little bit about how the treatment is delivered to the patient. And I have a question here But I'm not sure if I should answer questions now or we'll wait until the end.
No, we can absolutely answer. The question here is about the number of passes you generally use. Tell us a little bit about that.
Honestly, Dr. Shalin, I usually do 1 pass, maybe 2, and I get great results. So I think that's a great question, because a lot of those IPL devices, you have to do many passes. Obviously, you know, if you're treating an area that doesn't have a lot of pigmentation and there's just scattered pigment that is hard to kind of like bring up, that's when I do my double passes and maybe even go a little stronger in those areas, because it helps with the treatment outcome. But in general, I usually do 1 pass and I get really nice results. So I'm sure that by doing 2 passes, when I've done it, I've gotten excellent results as well. But most of the time, I just do 1 pass.
I think that, you know, sometimes it's hard to understand how the Nordlys can be so effective with such low energies. And the question often comes up, and the other question that often comes up is the question surrounding cooling, because it doesn't require cooling. And so one would think, if they have experience with other IPLs, how could it be effective if it really is something that doesn't require cooling and uses such low energy? But
that was actually my first reaction when I got this laser in the office, because I had a previous laser and I was doing different settings, higher settings. So I kept telling the instructor that came in, and I was like, "Are you sure? Are you sure I don't need to go up?" And she was like, "No, I promise you, if you treat them at this level, they'll be fine." And sure enough, you know, as I started treating people, I noticed that I needed a lot less energy than I used to, which is very, very interesting. So I'm gonna play another video, a short video here, just to show you how easy it is to kind of like put in the settings, and how much you can use the actual device to kind of like talk about expectations with the patients, which I think is very important, because there is before and after pictures in the device. They appreciate that. They appreciate when you tell them what to expect in the next week and all of that. So here we go.
Selected the VL555 from Nordlys. Once you've selected the patient's name, this will take you into another screen, which is this one, and you'll be able to select the treatment option. In this case, we did VL555, and we're going to be treating her diffuse redness and pigment. And one of the great aspects of the IPL from Nordlys is that you can select the patient's skin type. In this case, we're going to say she's a 2. If they have a suntan or not, and then you press the OK or the Go button, and it gives you already some settings that you can start the patient on, see how their skin react, and then depending on what you're seeing, you can always up that energy or go down. I'll probably up the energy a little bit, but we're going to start with the one that is set for us at 9 joules per centimeter squared. So one of the excellent things about this device is that you're able to show the patient, once you've selected the right treatment for them, what is their skin going to look like right here on the device. We have clinical endpoints for all the different treatments that we can offer, and they can see how their skin is going to look a day after and then 10 days after, so that they understand the concept of what's going to happen in the next couple of weeks while their skin is healing.
Excellent. So what we'll do now is go to the before and afters, which I think all of you really appreciate. So this is a patient that I treated in office. She was concerned with redness and benign pigmented lesions. I only have the picture of her after 1 treatment, but we did 3 treatments, and she's extremely happy. And all of like the redness and the pigmentation has subsided. When they're a skin type 4 or 5, which obviously 5 I'm very careful with. I prepare their skin sometimes with a little bit of hydroquinone and retinols ahead of time. I do that. Obviously, that's totally like unrelated to the device, but it works really good for me when I'm treating skin types 3, 4, 5. And I let them know, we're going to start slow, see how you react, but I've gotten excellent results. This is another case. She's more of like a 2, but she did really well after 1 treatment. And as you can see, the delivery of energy is very low, as we were talking about, and the results are excellent only after 1 treatment. You can really see also a little bit of a glow under skin, which I appreciate that, and obviously the patients do. This is more like a skin type 4, and the pictures don't make justice in terms of like how her skin type is. So we went slow, and she did excellent. We finalized with the 3rd treatment, but this is after 2 treatments, and you can see the clearance is pretty incredible only after 2 treatments at very low energy, and no complications pretty much. This is a for sure 4. And, I was a little concerned at the beginning when this patient came in because she had so much. So I started with the VL 555, which is a good option to do when they have a lot of either redness or pigment. You want to start with that VL 555 and then kind of like graduate them into the PR 530. And that's what we did with her. And she's extremely happy and love her results. There's another case also after 1 treatment, but obviously I always tell them 3 treatments is ideal. And we do them once a month. And then, I tell them once a year, come in for your kind of like little touch up that we do only 1 treatment. And if they're good at their skincare throughout the year, then that's all they'll need once a year. But obviously if they go too much to the sun or misbehave a little bit, then we'll have to start all over again, which is okay to do. And then another great case where she had a lot of damage, but again, more of like a skin type 2, 3. So I felt comfortable going directly into that 530. And then I just upped the energy as she cleared more and more. And then some of like this device I don't have, but the hair removal treatments, as you can see, this is more of like a skin type 4. And I think it's important, to have a device where you can treat this type of skin types because it's the reality of our world. We have patients coming in all the time looking for treatments. And so to have something to offer to those patients with 1 machine is really incredible.
You're absolutely right. I think here too, with the hair removal, there is an applicator on the Nordlys for patients or for offices that see darker skin types, and it's called the HRD, which is meant for darker skin types, and it has an even narrower band, so you can treat skin types that are dark for hair removal.
And I think a lot of people have that misconception that they need a pulse dye laser to treat a port wine stain. Because obviously that's what we've kind of like known for years that works really well for port wine stains. But you can see here with the VL 555, and I can tell you I've gotten excellent results, not only with port wine stains, but with poikiloderma sebum and other conditions where they're hard to treat. Obviously, you're not going to get this result with 1 treatment, but this is after 8 treatments, and you can see an improvement on this patient's skin and their port wine stain.
I agree with you. This is one that I think is really worth talking about because I think that it really nails down why Nordlys is such a special IPL. And I think it boils down to the delivery of the pulse and the fact that very, very short pulses can be delivered all the way to sub-millisecond pulses, which only the V-beam pulse dye laser gives you those kinds of pulses if we're talking about classic IPL, classic port wine stain treatments, right? So for an IPL to get into the sub-millisecond range, which is sometimes what you need for very, very fine vessels, that's a powerful IPL with very consistent energy delivery. I find that you can set the Nordlys with parameters that are very similar to the pulse dye laser in the expert mode. You can set 3 milliseconds, you can set 1.5 milliseconds, 6, 7, 8 joules, which is really what you use when you treat with a pulse dye laser. Now, of course, there are so many other things that you require the pulse dye laser for, but I love this case here because it really showcases that 1.5 millisecond and below pulse duration.
And actually, you just reminded me of something very important, because we both do injectables in our office. And, you know, the last thing you want is to bruise a patient, but it can happen. And if you have something to treat the bruise, it really makes a difference for them. So I've treated bruises and they literally disappear within days. So I think that's very, very important to have in the office as well.
That's a great point. What settings do you like to use for your bruise treatments?
I'll use the 6 joules, 1.5 or 3 milliseconds, and I get great results with that.
Oh, that's a great trick.
Okay, so now we're gonna get into the fracs, which, as I said before, there's the 1550 and the 1940. And these devices are really good because something that I mentioned before is that they don't have disposables. Pretty much, you know, you have this little roller that detaches, and it's very easy to replace between patients, and you can clean it. So it's the fractional 1550 is going to be a deeper resurfacing device that is going to be good for collagen boosting and resurfacing. And then you have the Frax 1940, which is more of like an epidermal skin resurfacing and benign pigmented treatment, pigmented lesion treatment. So they have this great technology where you put in the roller on the skin, and I'll show it in a video, and it'll let you know if you're moving too fast or too slow. And it won't actually fire if you're going too slow, or it'll tell you kind of like, it'll beep so that you know you're going too fast and you're kind of like warming the skin too much. So it's really great because it's like an intelligent roller technology. And it tells you, you know, what area you've treated, how much have you covered. You can put percentages of areas that you want to treat. So it's a great technology. I really like using it. And I'll show you a little video clip of how I use it in the patients and how comfortable it is for them. I do put numbing cream for them before with this one because it does give them more of like a heat sensation, but the patients do really, really well. So I'm gonna play this video here.
So now we're going to go on to the second step of this treatment for Brooke, and we're going to use the Frax 1550. We've selected the Frax 1550 and we're going to put skin resurfacing. It is going to be a non-ablative type. We are going to select her skin type, which in her case is a 2, 0 suntan, and then we're going to go into the actual expert mode settings, which are right here. It's great because you are able to have a light source on the machine, as well as some cooling air that she'll feel. And also in this case, we're going to be using the 12 millimeter spot size to treat it. So now that we're ready to treat our patient, we're going to go ahead and give us some air so that her treatment is more comfortable. And as you can see right here, you can actually see the size, the spot size that we're going to be treating for her. Pain okay, Brooke? Okay, good. Are you comfortable, Brooke?
Yes.
Excellent. You do want to always be perpendicular to the skin so that the patient receives the correct amount of energy, and you also want to do it slowly when the Frax starts to beep. With those loud beeps is because you're going a little too fast, so you do want to do it slower so that the patient can receive the right thermal non-ablative treatment. Another great thing about this device is that you can use it on almost any skin type because it's a non-ablative laser, so you're able to control the energy and the delivery of the energy and treat almost any skin type, but obviously always do a test spot before.
Okay, great. So that was a little sneak peek on how the fractional device works. And here are some before and afters of just the fractional by itself. This is the Frax 1550, and it's really going to improve the skin texture. It's going to give rejuvenation. It's also great for scars, and I'll show you a little bit of that. And then Dr. Shallon, she's more familiar with the Frax 1940, so she can talk a little bit about that device.
And, you know, in practice, you're right. We use both, right, the 1550 as well as the 1940. But what's unique about the 1940 is how much pigmentation it can remove all by in and of itself. Now, of course, if you had the entire platform, you would probably combine one of the IPL applicators like you do in the Light and Bright first, and then do the 1550 or the 1940, depending on what you were trying to accomplish. But with the 1940 applicator, because it has such a high affinity to water, the 1940 wavelength, it doesn't penetrate as deeply, and the injury it creates is a very concave type of shallow injury that has a larger density. So it gives a nice result with discrete pigmentation, with diffuse pigmentation. In my practice, I find that it improves post-inflammatory hyperpigmentation that's more superficial. So all of those things. And because it really gives such a superficial injury, any of the post-treatment care that we provide, such as vitamin C or tranexamic acid topically, it really allows the penetration of those topicals after. So in practice, I think it's a very unique type of delivery. How about in terms of post-treatment care? What are some of the kinds of things that you like to use after 1550 or 1940?
I actually will give them some cream. I use a lot of Elastin and a couple of other options in the office for post-procedure so that they can recover faster, pretty much. So I like giving them something that they'll use for that week in terms of recovery. And then once the week is over, they'll go on back, if they are on a hydroquinone or a retinol, back on that so that we prevent some of the hyperpigmentation. I do notice there's some questions, so I'm going to try and tackle those.
Coming in rapidly.
Yeah, I love that. Keep them coming. So can the Frax be used for stretch marks on the breast? I've actually treated a lot of those. If there's redness, I'll treat with the with the PR before or the VL, depending on how strong they are. And then I'll on top do the Frax 1550, and I've gotten really nice results. If they are skin color, I just go directly into the 1550, and I've gotten really nice outcome. When stacking for the Light and Bright, are you treating the same day? Yes, I am. I love stacking treatments. I treat the same day. I do put topical anesthetic. The one that I use in my office is lidocaine 20% ointment. So that's it. That's what I use. It works really good. The patients really like it. Let's see what we have here. When stacking the 1550, do you prefer IPL first? Yes, definitely. So I'll do, well, I don't have the 1940, so I won't do, I don't do that one in my office. I don't have it. I'm hopefully I'll get it soon. But what I'll do is I'll treat with my IPL first, then we wipe out the gel, and then we treat with the Frax 1550. Let's take a look here. Was the machine blowing air on the patient? Yes, it was. There is a cooling device that is part of the 1550. And pretty much you can turn it on or off. And I really like that option. Most patients love it on. It does give them a cooling sensation, and it's much more comfortable to treat with that blowing air. I do numb prior to the IPL. And then I have a question on how do you access the before and after pictures on the device? And I don't want to say the wrong thing. I think it's on settings.
Yep, and we'll answer that behind the scenes there.
Okay. And then what about breast scars from either cancer or surgeries? Yes, you can treat those. I treat a lot of scars in my office, and I've treated scars on skin types 3 and 4 with really good outcomes. What is the highest energy you've used? Oh, I'll show you. I've used pretty high out of the parameters, but you have to understand that obviously the higher you go, the longer the recovery is going to be for the patient, and also it's not for every skin type.
Right.
Let's move on.
Before we move on, if we just pause on that one, especially because we're talking about darker skin types and Hispanic and Latino skin types, energies we find even with ablative lasers are not the issue as much as density, right? So tell us a little bit about how you maybe decrease the density for those skin types or decrease the number of passes for safety.
Right. I actually, on my skin type 3 and 4, I'll only do like 1 or 2 passes. On skin types 1 to 2, I'll do 3, 4, as much as they can take. And then you get more of that resurfacing effect. But I do go lower on my passes. And the density is actually the percentage of the area that I treat is lower as well. So I'll treat like 15, 20% instead of like 35, which I'll sometimes tackle in my skin type 1 and 2. So definitely not so much the energy, as you said, but the density and the other factors play a role here. So it's important to take those into account when you're treating skin types 3 and 4. And I'll show you some of the settings of the before and afters that we have. Okay, let's go on to the light and bright treatment. As I said, one of my favorites. I really enjoy that. And you can see here some of the before and afters, and you can really see a change not only on the evenness of the tone, less red, less browns, but really the texture of the skin improves so much. And here we use the Frax 1550 at 38 millijoules, 25% coverage, 2 passes. On this one, we treated her with the PR 530, more for like some of like the acne scars and the little blood vessels. So I like using that facial telangiectation when they don't have a lot of pigment, because it really clears the little pigment that is behind, and obviously the redness and the telangiectasias. And they really love the results with that one. And then I use a higher energy because she's more of a Fitzpatrick 2-3. So I went with Frax 1550 at 40 millijoules, 25% coverage, 2 passes, and I've done 30% coverage on her, and she's done great as well. And on this gentleman, he had a lot of actinic damage. So we used the VL555 and then the Frax 1550. And on him, I actually went pretty high on the percentage, but we had a really nice result. And the reason I did that is he only wanted to treat once. So when they only want to come in once, you gotta kind of like push yourself a little bit, obviously without affecting the outcome of the treatment and being safe for the patient's skin type.
These are really beautiful results.
Thank you.
I was just going to focus on the men, because we do get some men as well, right? And I find that they really appreciate the difference that the 1550 makes, and the texture on that patient's skin was really notable. So just wanted to pause and take a look at that.
Thank you. No, another reason why I really, really love the Nordlys is because I have a lot of acne patients that, you know, we've treated their acne and they have a lot of scars, or they even have active acne and they don't want to go on oral medication. They want to try something different. So this is a device you can offer to your patients. And these, unfortunately, I don't take as many pictures as I would like to. Sometimes it gets busy and I don't have so many pictures of my acne patients that I've treated, but they really are outcomes like these, which are great outcomes, and they're not mine. But I mean, these patients really do well, and this is only with the 530 IPL. So you really notice a change in their tone, and the decrease of the vascularity here is really incredible when it comes to the scars. So I think it's important to notice that. And I know Dr. Shalin will talk more about these great results, but they're excellent. And as you can see in some of like the next slides, like this one here, there is a high energy that is being used, but a lower percentage in coverage, which, as we were talking about, you know, that will help you be a little safer with the skin types 3 and 4, and get the right outcomes that you want for their texture and the skin resurfacing without having hyperpigmentation issues, which I think is
exactly that. 1550 histologically looks like a column. It makes columnar zones in the skin, zones of coagulation, so it gets nice and deep. But the very good thing about that columnar type of injury is that when you lower the density, you're really not impacting so much of that DE junction. So you leave a lot of the DE junction left untouched. You go deep into the skin to get the deeper layers of the dermis and the full dermis, in fact, if you want in some areas. But that DE junction where we're so prone to creating hyperpigmentation if there's prolonged inflammation, that's left relatively unspared. With lower density treatments and high energy treatments, you get very nice results.
Excellent. Yeah, I think that's a very important point. In this case, this patient was treated with a higher energy, but again, 20% coverage, 2 passes. So you're really being safe. And this is, I mean, an incredible result. And it really shows you how great the stacking of the 2 treatments is, and the light and bright treatment gives you excellent outcomes. Obviously, this patient was treated 6 times, so it's not from one day to another that you get this result, but it's a hand-holding process with these patients. But if you are treating them with the device, you really get a great outcome. And in terms of texture, you really see great results here for acne scars. And there's different type of acne scars that this patient has. And to be able to get this only by treating with laser is incredible to me. Again, high energy, but lower percentage, 2 passes, and obviously doing that PR 530 before at a low energy, low fluence, because this is more like a Fitzpatrick 4 to me, 3 to 4. So you have to be careful, but excellent outcomes. I really love the light and bright for any type of rejuvenation, acne treatment. It makes a big difference on their skin. And one of my favorite ones, the ND-YAC 1064, I feel like this is the one that you don't care for so much when you buy the device and then you fall in love with it. It really is designed to treat telangiectasias, venous lakes. I've treated cherry angiomas, onychomycosis, warts, leg veins. And the patients really like it. They see a result right away. And I think that's very important, because we all want that fast outcome, and you can get that with this device. It basically has 3 different tips for the hand piece. And the spot size go from 1.5 to 5 millimeter. Pretty much it has this circular one that doesn't have a sapphire, and that one is good to treat, telangiectasias, hemangiomas, and all of that. And then you have the semicircular one that it's easier to treat closer to the eye, obviously with a shield, a shield inside the eye to protect the eye, and to clear the nail fungus and other treatments for the nail. So that one's good for that. And then you have the sapphire one that you can use to put in a little bit of light pressure and isolate that feeder vein so you can treat. And I've treated blue veins, red veins. It really is great, and it really takes them away, which is excellent. Here, a venous lake treatment, and this was after one treatment, I believe. And then you have, blue veins that some patients think they cannot be treated, or, they've been told that, and then you use the device and they love you afterwards. So here, a little video that I'm going to show you on how you treat them, and they kind of like get the cherry angiomas get darker right away. So I'll play the video. It takes a couple of seconds here, and then the other videos. Let me see if I press correctly. There you go. Now we're going to play it. And it also has a spray, so you can hear like a little bit of a spraying going on as well. And then again, this is more of like the telangiectasias and facial vein treatment. And I'm gonna play little videos here for you so you can see how the actual treatment is done. Here we go. Now I think I did it. So I hope you can visualize there, but the veins pretty much disappear as you treat them. And then the other video that has, I think, a little bit of a sound to it. And you can just see them go away.
And we have a question, Dr. Baum, about your treatment settings for the cherry angiomas with the Nd:YAG.
Okay, so I usually go up to 300 in the settings, pretty much the same as I do for my facial telangiectasias if they're between like 0.5 and 1 1 millimeter, between 0.5 and 1 millimeter. So I usually go around 300. That's kind of like my sweet point. I'm not sure what you're doing, but I like that.
And I love that you brought that up. I tend to use the PR530. So this is an interesting thing I learned differently. Yeah. So I tend to use the 530 and I'll use a shorter pulse duration if it's a small cherry, and if it's a larger one, a longer pulse duration. Usually a single, put it to a single pulse rather than a double pulse.
Excellent. Let's take a look at some of the questions if we have time. Do we have a little bit of time?
We have some time, and mostly the questions that we have now are really surrounding some of what you do prior to treatment in terms of preparing the treatment for, especially in the darker Fitzpatrick skin types, when you use hydroquinone, how long, what's your protocol, and then whether you numb patients typically for all of your IPL treatments.
I do numb my patients, even unless it's only for vascular. When I'm only treating vascular, I don't numb them because then they become more red and I feel like I'm not going to get the right energy on their skin. So I tell them to really be good about taking the pain. I mean, if it's a patient that has a lot of vascularity, I may numb them. But if it's light vascularity, then I prefer not to numb them. And when I treat those little veins, I usually don't numb. But when I do numb, I numb with a topical anesthetic, which is a 20% lidocaine ointment that I prepare at a specialty that they prepare at a specialty pharmacy. And the gel that you're seeing in the video is ultrasound gel. And the way that I prepare my patients is about 2 weeks to 4 weeks prior to doing their laser treatment. If they're a type of patient that I know is prone to hyperpigmentation, or they've had issues in the past, or they have a darker skin tone and I'm concerned, then I'll tell them that I will kind of like send to a specialty pharmacy a Klickman formula, something like hydroquinone 6% all the way to 8%, a little bit of tretinoin in it, like 0.025%. I'll add a little bit of ascorbic acid in the mix, and sometimes I use also a steroid in it so that they don't get irritation from it, like a low potency steroid, and I'll have them use that for 2 to 4 weeks before treatment. That week that they do their treatment, if it's a resurfacing treatment, then I'll have them use Alastin or one of these, or Sente, any of the creams that are good for repairing of the skin. If you don't have skincare in your office, telling them to use Vaseline or Aquaphor will be good as well at night. And like I said, it's non-ablative, so it's not like they're gonna be all crusty or anything like that. And then after that week, they'll start again with their Klickman formula or their prepared cream and use that until I see them back.
That's great. We have a question with regards to the ND YAG and using it off the face for leg veins. Do you use it for leg veins as well?
So we treat with sclerotherapy most of our patients, but whenever I've had patients that have very small veins, or they mention it to me when we're in the room and they see the results on the face and they ask, oh, can we treat leg veins? And I tell them yes, and I treat some of them. So I definitely have treated them. I've gotten excellent results with it. It's not our gold standard treatment. We usually recommend a sclero just because it's something that we have in the office, and I do believe that in certain cases is a better treatment. But when they're tiny veins, I've treated them and I've gotten really nice results, and the patients really like it.
That's great. And I think there's this question has come up a couple of times with regards to coverage percentage. And so maybe we can talk a little bit about density in fractional treatment. So this applies really to the FRAX 1940 and 1550 and density. So what do you think, what's your take on, how do you choose your densities?
I mean, honestly, when it's a patient that I don't think I'm going to have a risk of hyperpigmentation, I go up on the density. Like I said, I've used 35 and 40%, as high as it goes pretty much. I am aggressive when treating. I want the patients to see results. And I feel like if you have the technology and you have a patient that is skin type 1 or 2, they're going to do fine. And they're just, the recovery may not be the nicest that week because they'll have like a little more recovery time or a little more sand-like feeling on their skin. But at the end of the day, they're going to get a better outcome. But when it comes to skin types 3 and 4 or Hispanic skin, I do tend to go more on like the 15, 20%. Rarely I'll go to 25. And like I said, Hispanic skin has a different type of spectrum of skin types. And so when they are that 1 and 2, that's when I get more aggressive. But I definitely try to stay in that 15 to 25% density so that I have less chance of having an issue. And like you said, getting into that D junction, which is when you run into trouble when it comes to laser devices.
And I think with the 1940, that's what's interesting is you can really play with the density if you're trying to get discrete pigment, and you can also play with the scan width. And it's on the Nordlys, you just press a button and you can choose right between 4, 6, 8, 10, and 12 millimeter scan widths. And so if you have something discrete, you can increase the density to the highest density and decrease the scan width to the lowest scan width, and really just go back and forth over a seborrheic keratosis or an actinic keratosis or something that's very discrete, that's benign, and eliminate the lesion that way. So that's another way that we play with density with the 1940.
Wow, that's great.
There's a question here about the treatment, your treatment of melasma, and do you treat it, and what are all the different ways that you treat melasma?
So I do treat melasma, and I treat a lot of melasma in my office. I try to, I don't have a pico laser. That's one thing that I can tell you. So I try to stay away from devices. However, I can tell you that I've used my pulse dye laser as well as very, very low settings for redness, because remember, melasma sometimes has a blood vessel component and a vascular component. So if you can treat that, depending on the type of melasma, if you see the vascularity of that melasma, I've treated it and I've gotten really nice results. You have to be careful with the delivery of energy and heating up the skin, but this is a good device to go very low on. I definitely don't suggest to use this device for melasma because it's kind of like my last resort, but I have treated patients, especially for that vascular component, and I've gotten nice results with either my pulse dye laser or the 555 at low settings. So I've done it. I use a lot of topicals. I use a lot of, I combine with peels, and I've used oral tranexamic as well off-label, and I've gotten nice results. I also offer Cispera in the office or Histamine. So I try to use as many topical agents as there are available, and combine them and see how well they do and go from there, depending on if they're improving, great. If not, that's when we move on to devices. And, you know, since I don't have a pico laser, I'll refer out if I think that they would benefit of that treatment.
That's true. It's a complicated condition, so many, many different ways to treat it.
Yes. I'm not sure if there are other questions here, but let me know if I can answer some of the questions, because I know a lot of them came in.
Yes, there is a question in terms of who would be your ideal patient for combining 1550, and 1940. So I think that probably we can both answer that one, but combinations in general, who's your ideal patient for combining IPL and 1550, for example?
Honestly, any patient that has an issue with different color on their skin or pigmentation, redness, whatever it is, together with textural issues, either because of scarring, because of sun exposure, because of their skin just aging. So that combination, if they are looking more for textural changes and evenness, that's when I do it. But like I said, I think I love that treatment, and if I can do it on patients that I feel they have the need for it, I will, because the outcomes are so much better than just using one device.
And I totally agreed. And I think the interesting thing too is adding 1940 on top of that really helps with that very top layer and really getting some good post-care effects when you're doing post-care with something like vitamin C or tranexamic acid. You really get that channel open for some period of time. So that's maybe that added icing on the cake if you finish it off with a couple of passes of the 1940. And with the darker skin types, the lowest energy, the lowest density is a nice way to finish off that treatment.
Actually, you bring that point, which is great, because we do offer platelet-rich plasma as an add-on to our treatment when we do the fractional, the light and bright, and the recovery obviously shortens up a little bit, and they really like it. they are getting, those channels are there and they're absorbing. So it's a great way of assist in the delivery, as you said, of any, thing you want to put on your skin, any cream or anything like that, it's going to be absorbed. So we like putting platelet-rich plasma after treatment, and the patients notice a change and a nice result there.
That's great. Well, our final question tonight is surrounds scars and your approach to scars with this particular device, or even with your pulse dye laser. How quickly do you treat the scar after the injury?
Well, data now has shown that you can treat it as fast as 2-3 weeks post scar treatment, like when the scar is formed. So after 3-4 weeks, we usually get them in and we start treatment on patients that have had Mohs treatment or patients that just come in and they recently had a scar. I target scars based on what they look like. If they have a hypertrophic scar or a keloid, then we're gonna inject them. If they have redness on them, we're gonna target the redness. And then obviously we want resurfacing. So if it's a scar that needs a lot of resurfacing, then I'll probably use my core, my CO2 laser, and really target it that way. But if it's a scar that my fractional will do its job, then I obviously will treat the redness with the IPL and whatever vascularity I see. And then right after, I'll take off the gel and do a couple of passes, and I've done on scars up to 6 passes, depending on the thickness of the scar and what I'm trying to accomplish. But that I'll do with my fractional, my Frax 1550, and the results are really great. I love what I see with the scars. But combination treatment, stacking treatment is the best. So that is a good time to assist with the laser and put on some Kenalog right after and just rub it on the scar. Once you've treated it with the cord device, the CO2, or with the fractional, you can just apply the Kenalog and massage it into the skin, and it gets absorbed with those channels that you've opened up. So you can use other things. I've used Sculptra, depending on what I'm trying to accomplish with the scar. And if it's a hypopigmented scar, we know that lattice can help. So there's different things that we can use in our favor to help the patient get the best outcome every time we open up those channels.
Well, thank you, Dr. Baum. Before we go, do you have any closing thoughts you'd like to leave the audience with, or anything you want to comment on surrounding our last slide here?
No, basically, obviously to take into account the Hispanic population, because it is a growing population. They're going to come in your office and they're going to ask for aesthetic treatments, and it's good to have a device or some options for those darker skin types, to have something that, it's going to give less heat, less fluence, so that you don't run into the issue of post-inflammatory hyperpigmentation. And more importantly, that, this is a great device for a growing practice. I think, the residents come into my office, they graduate, and they always ask me, what's a good device to buy? And I really believe an IPL, and especially this device where you have, not only an IPL, but the option of resurfacing and treating veins and treating onychomycosis and other clinical conditions, because as you start your practice, you may not only be doing cosmetics, but it's good to have that other aspect that you can treat for the patients, as well as acne treatments and things like that. So I think it's a great device. I'm very happy with it, and I've noticed excellent outcomes with my patients, which I think is the most important.
Thank you so much for sharing all of your experience tonight with us, and thank you to the audience for joining us this evening. I'll turn it over to Grace.
On behalf of Candela, I would like to thank you for your participation in the virtual meeting. Once this meeting ends, a post-event survey will appear requesting your feedback. Please take a moment to complete this survey as it will help us plan future events. This concludes tonight's program. Have a great night.